TH1 and TH2 for the response that is required. You don't have to take that every day. What you need to do every day to boost your immune system is to reduce the GI inflammation. That's what you need to do. If you reduce that significantly and you sleep well and you don't eat sugar, your immune system is in good shape. Then you boost it over necessary. Is this clear, guys? It's very important. If not, the immune system is distracted and those cancer stem cells begin to grow. Okay? And yeah, no, that's fine. I'll give that to it. Okay. So that was immune system, immune support. Let's go to the other supports that we talk about. So we also talk about the products we do here, GI support. So there are 4 products that everybody needs for GI support. Kim, what are they? Oh, Enda, what are the 4 things that you need?
Probiotics.
Probiotics? Why do you need probiotics, Enda? Every day. Why do you need it every day? Sorry, Jack? Correct. Because in our stomach we have, or in the GI lining, we have good and bad. And the bad tends to increase. So we want to make sure we are always putting good one in. You know, if you look at the Bredesen protocol for Alzheimer's, for Parkinson's, one of the big, and even for autism, one of the big issues at the core is the bacterial architecture. So a lot of those people have bad GIs. When you can fix the gut bacteria, it actually addresses a lot of the underlying chronic illness issues.
Like you need to feed your probiotics.
Well, I was going to go there. That was just number 1. Yes. So what's the second one, Rick?
You need prebiotics.
Yes, prebiotics. And as Rick was just saying, the prebiotics feeds the probiotics and they create this very interesting ecosystem that enables good digestion and manages the mucosa really well. What's the third one? Digestive enzymes. Why do we need digestive enzymes? No, that's not why we need them. Yes, it breaks down the food, but why do we need them every day?
Because as you age.
Correct. It's an aging issue. So his digestive enzymes are much better than mine. So I need help every day. So when I take carbohydrates and proteins and fats, I need more help with the pepsins, the lepsins, the amylases that actually break those things down. So digestive enzymes are very, very important as we age to support the breakdown. Right? And what is the last one?
Fiber?
Huh?
Fiber?
No, it's the nutrients themselves. Fiber is that. The nutrients themselves, right? The quality of the nutrients. I was at the farmer's market buying fruit this morning and some cakes that you're going to enjoy. You know, every Saturday you celebrate with some sugar. We're human beings. We need a celebration, right? Once a week, at least. So life doesn't look like punishment. We're not in hell yet, so I want to make sure we enjoy purgatory. So the nutrients, you want to make sure that the quality of the nutrients, you know, most people tell me, oh, I eat well. I roll my eyes, you eat well? Where does that food come from? Most of American food is crap. Just tasting it, you know. Taste the chicken. There's nothing there, it's nonsense. Go to Vietnam and taste the chicken. Then you know how chicken really tastes. So the French guy who's doing the bakery, we're talking about the taste of food here, and he was like, even the tomatoes have no taste in America, right? I was in Germany a couple of years ago. You taste the tomato and it's like glorious. Here, The tomato tastes like paper. There's nothing, no nutrients in that shit. It's just cardboard paper. So what is your alternative? You need to look for a good source of nutrients. If not, you're just really, you're suffering. Your body is compromised. It's a very important issue. So that the GI support issue, as I said, this is the key architecture that you need to fix. It's the number one issue of sickness for everybody, inflammation and the compromised immune system. So if you're not taking this as standard every day, you have a big problem. You have a war raging in your stomach that you're not even aware of. You have bloating. If you've used my bathroom, you see the Bristol chart, right? Your poo is not, oh, you saw the chart? Your poo is not a number 4 poo. What's your poo like? You don't look at your poo. I look at my poo. This morning I looked at my poo and it was a beautiful number 4. You should check it every time. You should check it. It's your poo, it's not mine. And you're the only one in the bathroom, so you just look at it before you flush it. After you finish poo, you stand up, look at the poo, and see what your body is producing, and it informs you for your next meal, right? That Korean barbecue I had last night was not a good idea. My stomach is telling me from the output, right? Oh, that Thai whatever you had was not a good idea, right? Yeah, the papaya salad, yeah, with that lemon or lime was not really a good idea, because the poo smell and the poo structure is telling me that my GI did not like it, right? So if you're doing these other things plus nutrients, all of a sudden your stomach begins to play orchestral music, right? Begins to play symphony, right? Because everything is in tune, right? And your whole body, you start feeling different. You should see the literature on interventions for Alzheimer's, right? Pear is sitting here as a wonderful example from Rick and Seman. Look at the examples for autism and the recovery just by focusing on the GI. Schizophrenia, people are recovering. Instead of giving them medication for life, we just feed them properly. People are recovering. That's why we don't have many crazy people in Cameroon, because they're eating well, right? We blame it here on drugs. These people don't have good GI architectures, right? So it's very, very important that most Americans are not eating well. So don't be deceived by that nonsense. So go make sure you are addressing those issues every day. So I take a digestive enzyme, I take a prebiotic, I take a probiotic. I think it's a 50 million, 50 billion, or 100 billion, and make sure that I take good nutrients. Okay, it's very, very important. Now let's talk about musculoskeletal support.
I have a question.
Yes.
Do you have a package for supplement for 3 of these ones, probiotic and pre-digestive enzyme?
Yeah, we have a bundle. So if you go to the website, it has these bundles, right? Dimitri, where's Dimitri? So we'll have like an immune support bundle, and it will tell you all the things that you need. It also depends on what you can afford and what you want to buy. Some are very expensive. I showed you the high range. This is like the one for people who are taking cancer treatment, or if you feel that you have a genetic risk for cancer, you want to build your... And then there are things like the one from Research Transfer Factor Multi-Immune System. It says this is a complete immune support. It's clinically researched, so everything that we carry has research to support it. It nurtures healthy NK levels, that's your T cells. It promotes healthy Th1 and Th2 modulation. That's the architecture for the immune system. So these are nutrients that go to the heart of the matter. So you ask that question, this one I take.
Yeah.
I don't take it all the time.
Yeah, I discovered that's my problem. Why I don't sleep? Because the GI mind is bad.
I told you that, Jad, a long time ago. Yes, and so normally when you are a patient, that's the first thing that we work on for 6 to 9 months, because it takes 6 to 9 months to repair the GI. So because we have to rebuild the mucosal lining and achieve what we call the microbial diversity to make sure that you have so if you were cesarean born, it's very more challenging, right? But if you're vaginal born, then at least you have hope that the repair would be done quickly. If you're cesarean born, most times your GI is already compromised, right? That's what all the research is pointing to.
Yeah.
Was your daughter cesarean?
Yeah.
So she must have a compromised GI.
I am cesarean.
That's why you have a compromised GI too. The research is very recent and very clear on the issue that most children who are cesarean, and so even now they are doing fecal implants, where they take the poo of a healthy person's GI and implant it into people who have problems with their GI, so that we can get a better bacterial diversity. It's a very, very important issue. Okay, let's look at musculoskeletal support. Last week my teaching was on the musculoskeletal imbalances, and I was teaching that there are 3 parts to the musculoskeletal system. What are those 3 parts? Soul, you were here? Soul, look at your notes. Muscles,
The muscles, the bones,
the bones,
cartilage.
ligament and cartilage, right? That's what holds this architecture together, isn't it? That's it. And what is the biggest problem in the musculoskeletal architecture for human beings? Pain. That's why we have the opioid crisis. Pain. And what is pain in the joint, so? Where does it come from? Inflammation. And where does that inflammation come from? Exactly. So even arthritis is a GI problem. Do you see that? And what do we do now? We write medication for them rather than fix their GI. So when I watch the democratic debate about the healthcare system, I find it funny. It's like comedy, because we are going to go bankrupt if we don't take lifestyle into our hands. We cannot afford to pay for healthcare for everybody living a lousy life.
It's not healthcare, it's sick care.
It's sick care, exactly. Right? We can't. You know how much this hospital charges a day? Over $4,000 overnight. $4,000 overnight. And for that $4,000 we could fix people's GI. That's why most of them are in there. Do you understand that? And that's the silliness about the culture and the stupidity about our healthcare system, that we're all training doctors in bullshit, and yet nobody's healthy. Right? They're all spending billions for cancer research when we could just fix the immune system. See that? And that's what this is about. I'm very bold about this because even the medical research on it is very clear. And we're being lied to. Because if you go look at the research, you see that very clearly. We know that Alzheimer's is a type 3 diabetes. And so if you fix diabetes, you fix Alzheimer's. If you fix the diet and the lifestyle, you fix a lot of that. Okay? I'm going to stop here and take questions. We have a lot of other support things we do, and perhaps I should just run through that because we have some new people today. Let me run through our 8 lifestyle attributes for high performance health. I should go through that every time because we need to remember this. So number one is sleep. And it must be 8 hours. Right? It's taken some people more than a year to achieve close to 8 hours of sleep. You must sleep 8 hours a night. And implicit in that sleep, they call it sleep hacking, is the amount of REM sleep that the brain requires. And if you're not sleeping enough, the risk of Alzheimer's is very high. Very, very high. Because the brain is not having enough time to clear the debris. It's very important, guys. Sleep is one of the most important lifestyle things that we talk about here. It's very, very important. Number two, exercise. Movement is a critical part of our architecture. You have to move, and we talk about the 4 kinds of exercise. What are the 4 kinds, Kim?
Cardio. Intense. Yeah, stress.
Strength,
Weight.
stretch, and weight. So we need to do all of those things, right? That's why those repetitions are important, right? And I put that picture on Facebook of this woman, and her head gets here, and it shows that it cures a lot of stuff if you have that level of flexibility. See, my head goes only 90 degrees. Imagine if I could fold it there, right? That shows significant flexibility and health, right? The other thing that they talk about is the ability to get off the toilet seat without support. You can sit and get up without support. It's a really strong sign of health, right? Yes. Oh, you squat
Squat. Yeah.
and stand up without support, right? It's very important you check those things out. Number 3, toxicity. Right? We spoke about the 4 different areas: water, air, food, and environment. Number 4, stress.
Toxicity or detoxicity?
Well, but you need to know where the tox is coming from to then detox. And so rather than focus on detox, I focus on cleaning my environment. Right? If you go to Asia, you find out that most people wear masks. It's a very important way because they know outside. So look at, I see people riding motorcycles on the freeway without a mask. Imagine what they're breathing on the freeway, right? With all these cars and all the exhaust and the dust, right? It's rare for you to find people on motorcycle in Vietnam without a mask, right? So they're aware, just different cultures, right? And the awareness that we have, right? Stress. We talked about stress earlier and the different ways to deal with it. Then we talk about nutrients. And we spoke about macro and micro. And we spoke about diets that are the diets that are significantly changing the landscape for chronic illness. Ketogenic diets. So we have a lot of support for those diets here. Or modified Mediterranean for young people, right? But for most of us who are in our 40s, 50s, 60s, we have no choice but to go ketogenic. It's really the only way to really save yourself and not have to deal with all the carbohydrate bullshit and all the consequences of carbohydrates. Number 7, I focus on relationships. Right? Because some of our sickness comes from toxic relationships. And what is the big issue with relationships, Rick? What's our biggest challenge with relationships?
She's always right.
No, that is submission. That one is different.
Excuse me, Coach, I think you have Alzheimer's. You've gone from 4 to 6.
I jumped.
Miss 5.
I'm going to come back, yeah. Wow, that was a good jump. All right, I'll come back to that. So what is the big issue with relationships? Let me ask a young man. Nagan, what is the big issue with relationships?
Communication.
No.
Communication.
Trust.
Huh?
Trust.
Yeah, what's the issue with trust?
Frustration.
No, he's right. It's trust. What's the issue with trust?
Expectation.
Really not sure.
Well, it's very difficult to establish trust. That's the real challenge in our culture. Nobody trusts anybody. So the stress that comes from lack of trust is significant. It's making us sick. We don't trust even the petrol, putting gas in our car. We're not sure about the quality of the gas. We're not. Everything in this culture is like, they're coming to get me, right? Then there's the immigrant stress on top of that. Then there's the sex stress or the race stress, right? Being a black man, you have the stress of being a black man. Being a woman, you have the stress of being a woman and being an ethnic woman. Should I go on with these stresses? We all pretend like it's not there. We all know it.
Turn the TV off.
Yeah, exactly. Right? And then there's this, but I don't have that stress because I really don't give a shit. And that's the way you deal with that stress. You don't give a shit. I don't give a shit. I don't care what people think about me. That's their problem. I know that when I look in the mirror, all I see is an amazing child who should be president. Right?
Then you really have stress.
No.
Then you got to deal with all the people who've been there.
No, Rick and Simona and Dr. Yi will be my secretaries of state.
Don't worry about it. You will make it.
No, I would not be stressed about it. I know what I would have done with Iran 2 weeks ago. Yeah, but I'm not stressed about it. Okay. So relationships, but at the core, apart from stress, there's something about relationships that's making us sick. And it's the issue of forgiveness. It's a really big challenge in relationships, and it's making us sick. Because forgiveness is not about the people who we are forgiving. It's really about ourselves, finding peace inside of ourselves. So I'm not talking about religion here. I'm talking about forgiveness, right? People do shit for you and you move on. Most people do not, right? They carry it, and that baggage is part of, at the core of chronic illness. I missed one. Which ones am I missing? My team, tell me.
Number 5.
And what is number 5? I know I'm missing number 5. Number 5 is what?
Below number 4.
Which one am I missing?
Exercise, toxicity, stress, nutrient.
And it's a big one. Why is it not coming?
Hydration.
Yes! Hydration! Yes, thank you, Rick. It's hydration. It's a big one. And there's one other one I can't remember. But these are the big lifestyle things. And so we have an idea here called intelligent lifestyle design. You need to design your day intelligently to address all these things. No excuse, right? Recently I've been going to bed, since I came back from Vietnam, I'm going to bed at 8. And I was talking to some patients yesterday about it, and they're like, why? I'm like, because I'm tired. Then I wake up around 3 or 4 a.m. How many hours? 8 hours. Then my brain starts running at the right pace for me to create, right? We need to find the time to sleep. And because I can sleep till 4, I can wake up, I can go to the gym early, I can do some work, and then play tennis and be at work at 8 a.m. Right? I've had 4 hours to do my shit. A lot of people complain, oh, I don't have time, and then they are at midnight watching some stupid TV. I don't listen to TV. I listen only to news at 1 p.m. on BBC, because most American news is fake news. It's nonsense. It's politicized nonsense. There are no facts in it, right? So I listen only to the BBC to get facts. I'm not interested in opinion. right? So because I don't also want to cloud my brain and with people's opinion, that's irritating, right? You want to listen to just pure facts. How many people listen to the BBC here? Just pure reporting, just facts, no opinion. So it's not irritating. They just say what happened. That's it, right? I wish we get back to that. Then also, I also break my fast around 10. So if you eat around 6-7 p.m., you don't break your fast until 10. We call that time-restricted eating. No eating at sundown. The architecture, our circadian clocks, does not support us eating at night. There are studies around it, huge studies. If you eat after the sun goes down, your metabolism and your digestion does not support it, right? So there was a study that just came out. People were eating the same, but they were eating whenever they chose. And the people who were eating whenever they chose were putting on 40% more weight than people who were eating the same within a time restricted, right? Then there's the calorie restriction or the diet type, right? For most of us, carbohydrates are bad for us, especially black men. Carbohydrates are just not good for us. Why? Because we came from a culture where we were running after tigers and lions all day long. And now we are sitting... Or sometimes I was hunting them, like my grandfather used to do, right? How many miles should you run a day? About movement, 23 miles. We were architected to run 23 miles every day. If you're not running that, you should not be eating carbohydrates. You should not. You're not expending the amount of energy that's required. So you should be eating only protein and fats. Are we clear about that? There's no excuse on carbohydrates, except when you come to this workshop, we give you some sweets, right? That's a little bit, just to tell you how good it used to be. So we have memories of the past, right, Rick? Of those days when we were this young and we could eat pizza at midnight and ice cream whenever you don't do those things, do you? You do, yeah, well, it's okay. You're at that age, you can do it. But know that you get to our age and you have to stop it, right? So learn to start controlling it now, all right? So thank you for joining us today. I hope you've enjoyed it. I enjoyed it. We had some good guests. Any final questions before I close down? Pear's been very attentive. I like it, Pear. Thank you. So, you look guilty because of that report you got, so... Did you do your body composition? You don't want to do it?
If it isn't broke, I don't want to fix it.
Okay, it's not about being broke, it's just about knowing.
I know.
Yeah, okay.
Very helpful. Okay. I like it.
Rick? And if you like it, go on Facebook and watch it 10 times and love it. You're going to do that? Good. And thank you guys. Have a good day.